Tonight on Recruits.
Got hit by a car, mate.
A teenage boy struck down. Jenna takes the lead role.
Does anywhere hurt when I touch your legs?
A mystery illness for a UK tourist.
What is actually wrong with this girl?
And a confronting sight for John.
Oh, God. I'm addicted to this universal feeling called life.
327 going to get you back down to Mount Druitt for a 1C MVA, please.
Jenna's mentor, Cleone, has attended hundreds of motor vehicle accidents, but this is Jenna's first.
Vehicle versus pedestrian.
And only the second time she's driven an ambulance in an emergency.
Just thinking of Jack on the door. This is much risk. Alright, so pedestrian versus a car, it could be a major incident. So pull up beside the police wagon, pointing to the yeah, on the right hand side of the police wagon. No, right. Turn your siren off. Pull up right beside him. Keep going, stop. Hello, what happened?
You walked out in front of the car.
Yep.
14-year-old Ian was crossing the busy road on the way to a friend's house.
Did he go up and over the car or anything? Who was the driver of the car? Did he go
Up on the bonnet. And by the time then I'd stopped and he'd fallen off.
The length of the skid marks indicate the driver had to stop suddenly. Even at 60 kilometres per hour, a car needs a safe stopping distance of 145 metres. Ian is lucky to be alive.
Get me some collars, I want spine board out.
Here I am, I'm rocking up to my first MVA, and there's just people absolutely everywhere. When I was at the college, we did do a scenario with a pedestrian that had been hit by a car, but it's a whole nother level trying to do it in real life.
Everything's fine.
No, it's not. You got a big whack on your head. Blood pressure's good, 120 on 80. You got hit by a car, mate. You thought you were Superman.
Ian's vital signs are good. It's now critical to establish whether he may have suffered a head injury.
So are you mum?
Yep.
Okay, is he alert to his normal self at the moment?
Yeah.
So he's told me it's Tuesday, or should he know it's Thursday?
He should know it's Thursday, but not necessarily.
He has got an element of memory loss, so he can't remember being hit by the car, he can't remember what day it is. That is a concern, because in a kid so young, they normally have fairly good memories, so we have to keep an eye on that. All right, let's get him on the spine board, get him in the car.
Ian's external injuries appear limited to minor abrasions. It's injuries they can't see that are of most concern.
Bleeds on the brain can kill you quickly or they can kill you slowly. It depends on how bad the bleeding is, and we can't tell that from looking at him. It needs to be immediately to hospital, and they will do appropriate scanning and all that if it's required. Ready? 1, 2, 3.
Pedestrians account for 13% of all road fatalities. Ian is one of the lucky ones.
I think you need to get Mum to buy you a lottery ticket. Yeah.
He's pretty lucky. He didn't really have any major injuries, so it's good to see a turnaround of a patient from where he was when we picked him up, where he was at hospital.
Real fun experience getting hit by the car, though.
A brain scan will reveal within a couple of hours whether Ian has suffered a brain injury.
Admittedly after the win and the cash prize, been swimming in guilt.
Trainee recruit John Williams has been on road with mentor Jordan for 4 months. Stationed in central Sydney, it's been a steep learning curve for the boy from the suburbs.
Working in the job has definitely given me a bigger picture. There is so much more to the way I viewed the world for the last 23 years, and there's a whole nother band of life of other people out there and the way they choose to live their life.
35-year-old male, unconscious, heroin overdose.
Sunday afternoon in Sydney's CBD.
Oh, God damn. 35-year-old male, heroin overdose. So it's in the park here, right in the city, so we'll go and suss
A
out.
motorcycle intensive care paramedic has already assessed the man and begun treatment.
Oh, okay.
Narcan can dramatically reverse an overdose within seconds.
Definitely still have empathy for people who just go out and write themselves off, whether it's alcohol or drugs, because obviously there's some sort of underlying cause for them going out and doing it.
Hello, mate. How are you?
The problem with heroin is it affects the breathing centres of their brain, so they become very hypoxic. He's quite blue, he's very pale, and he's still got a very decreased level of consciousness. He needs oxygen more than anything, and he's just received some Narcan, which will reverse the effects of the drug. Mate, I'm just putting some oxygen on you. Mate, it's just oxygen.
Well, I like that back, mate. Thank you.
It's just oxygen, buddy. Well, mate. Okay.
Paramedics are trained not to judge patients.
You've had an overdose, buddy.
No. Yeah, mate, you've woken up to some Narcan. All right, you're taking too much heroin. All right, mate, whatever, okay? Do you want to come to the hospital? No? Okay, just be aware, mate, if you use again today, you can have that in the pine box.
Yeah, all right, sweet.
All right? Appreciate it. Thank you very much. Okay.
That is a brilliant example of the drug Narcan because it works very quickly and it totally reverses the effect of heroin. So 1 minute he's literally teetering on the edge, next minute he's, as you saw, got up and walked away.
It's pretty critical because someone in that kind of state, if they're not given naloxone, they're not looked after and they're not monitored, can very easily go into an arrest or something serious.
The strength of heroin on the street is notoriously unpredictable. The overdose suggests a strong batch might be going around.
Over the last couple of days we've heard a lot of cardiac arrests secondary to heroin use. I wouldn't be surprised if we see another one or at least a couple more today and over the next couple of days.
Just hours later, Jordan's prediction comes true.
Think of this. Yeah, it's a female lying on the road. It's weary deceased. 45-year-old female conscious and breathing, life status questionable.
John and Jordan are sent to an inner-city location. They arrive to a confronting sight. Trainee John and mentor Jordan attend a Category 1 job. It's a suspected heroin overdose. Their second in 2 hours.
Wake up. Wake up, sit up. Oh, what's going on?
I just got a bit to walk on.
You're lying in the middle of the road. Someone thought you were dead. How much have you had to drink?
A little bit.
How much? Where have you been?
At a friend's place.
At a friend's house?
Yeah, not far away from where I live.
Apart from the alcohol, have you had anything else?
No.
Okay. Slightly?
Painkiller now.
What painkiller?
Painkiller, Oxy.
Oxys?
Yeah.
Okay.
Oxy, or OxyContin, is a prescription drug used to treat severe pain. Mixed with a depressant like alcohol, it can be lethal.
Have you had any heroin at all today? None? Okay, and how much OxyContin did you take?
Can
we put this because I think it might have affected you a bit more than usual, probably with the alcohol.
It's pretty confronting seeing someone like this because it's all self-inflicted. They don't need to be the way they are, so it's unfortunate that her life has led her to be like this. Can I just have this arm back for a second?
Oh, yeah.
Drug and alcohol-affected patients can be amongst the most challenging.
Stop touching me there, please. Leave me alone. Stop you touching my knee.
I'm just gonna...
I don't care what you've got to say, okay?
No, we're here to help you, doll. We want to help you.
She's kind of going in and out of being cooperative and then not wanting to know us and the next minute telling she loves us. So it's a bit of a difficult situation.
With an unknown cocktail of drugs in her system, leaving the woman alone could prove fatal.
Problem is, we have a duty of care.
But I know that I'm okay, right?
Yeah.
You have a problem.
We can't leave you the way you are, okay?
I'm okay.
You're very drowsy.
I'm okay.
The situation we have here is a woman in her 40s who's had a lot of alcohol today, but she also appears to be affected by other drugs as well. At the moment, she's very reluctant to come to hospital, but it's simply just not safe enough to leave her here on the street. So we're going to have a more sort of forceful discussion about why she has to come this evening. We really need to take you to hospital.
I don't need to.
It's going to be best for you up there.
I go to hospital, sit there.
As night falls, the need to get the woman to safety becomes more urgent.
Is there any way we could take you to hospital to get you checked over?
No, okay.
I think it's a really good idea.
Finally, they have no option but to resort to stronger measures.
Because she's refusing to come to hospital, we've had to get the police to come down and assist us. G'day,
Diana, how you going?
Hello.
My name's Richard, how are you? Whereabouts do you live? Redfern? You're straight from home a little bit, that's all right.
Police managed to persuade the woman that safety is the smartest option.
The nature of healthcare is that you provide everyone with care, and you provide that without judgment and without prejudice.
Thank you, it means a lot to me.
It wouldn't be much of a statement about me as a person, or John, or the ambulance service for that matter, if we felt disinclined to help people based on whether they'd used drugs or were affected by alcohol.
At St Vincent's Emergency, the woman will be safely monitored and undergo a series of drug tests. Life on the streets is about to become a reality for students at Paramedic College, where the next group of new recruits approach graduation.
Today is your last lot of practical assessments if you get through it okay.
Heads down, bums up, basically, because if we're not happy, we're not going to send you on road. It is that simple.
They keep drilling into us. If we don't pass, you don't have a job. So and nobody wants to fail.
It's their final theory assessment. With so much riding on the result, nerves are on a knife's edge.
Come on, patient.
This will all be over in 20 minutes.
You ready?
Yep, I'm ready.
They're being assessed on a simulated major trauma. All they know is that the patient has a broken leg.
So whereabouts does it hurt?
My right leg.
Respiration.
Their every move is scrutinised
I'm just going to check your pupils.
as they attend to the patient and make a box splint for the fractured leg.
You just push against my hand as hard as you can. Fantastic.
Those bystanders over there.
Patient, we're happy. Thanks a lot.
Now, the result. Raina and Danny are through.
I thought that was really good.
Okay, great.
Okay?
Very now we're going out on the road and we're doing it for real, and that's awesome.
But Blake's assessment isn't progressing quite so smoothly.
We got the box splint. I was moving it around too much. If that was a real patient with a real broken leg, then he probably wouldn't be too happy. One little thing, I've gone, oh no, and I've shanked it. That was just the end of me, I think.
Blake failed his assessment. There's one last chance to salvage his career. He must repeat the entire assessment again.
So there's consequences if you don't do well. So just be aware of that.
Failed twice, and he's out of a job. Night shift on Sydney's northern beaches. Trainee Carly drives under the supervision of mentor Jane.
So, come here often? Not usually.
At 9:30 p.m, an emergency call comes through to 000. Carly and Jane are assigned to the job.
Tell me exactly what's happened.
I have a 25-year-old English girl staying with me. She's now collapsed on the kitchen floor with heart palpitations.
565, copy. All right, so 25-year-old, short of breath.
The patient is at a horse riding school on the city fringes.
We went from being in the city to being in the country very quickly, having to sort of navigate through very dark roads.
Hi, how you going? What's her name?
25-year-old Jody is a UK tourist on a working visa.
Jodie, can you hear me? What's up? Jodie, can you hear me? Do you know what's happened? Seeing her on the ground's quite worrying because you're thinking, oh, you know, is she conscious? Can she respond? What's going on here? Is she breathing?
A week ago, Jody was bitten by a tick. Now she's getting rapidly worse and suffering heart palpitations, irregular heart rhythms that can be dangerous.
She was becoming progressively sicker. It was mild, but she wasn't very hungry, didn't want to eat a lot, didn't feel 100%, but sort of got worse over a few days.
Okay. It's not just old people that die, but we have young people that drop dead because they've had congenital heart defects that they've never known about. So there was definitely a sense of urgency.
A riding school on Sydney's fringe. Carly and Jane attend Jody, a UK tourist on a working holiday. A week ago, she was bitten by a tick, but that may not explain her condition.
Have you got the palpitations at the moment?
No, they stopped.
Okay, and you've never had palpitations before? Ever? No. But that all looks all right as well at the moment. Okay.
Jody's heart is beating normally, but her condition remains baffling.
Feeling like you're a bit short of breath? You do.
As a possible cause, Jane is contemplating a disease that is extremely rare in Australia.
Ticks can give you a disease called Lyme's disease. It can sort of be a bit funky in the way it presents. It's too hard to tell at the moment whether that's what it is or not.
The main things going through my head at that point was trying to get her up onto the stretcher.
The aim is we just got to get you on that bed. Okay? So however you want to do it, you tell us. And then we've got you on the monitor so we can see if anything changes. Just nice and slowly. Just try and get your bearings. How do you feel sitting? Hey? Not good. Not good?
Every time that we tried to get her up on the stretcher, she was becoming more faint and having problems with the heart.
Start fluttering.
So it comes to a point where you think, what is actually wrong with this girl?
All right. Do you reckon we'll give it a go standing up?
Yep. I'm definitely looking at Jane to tell me what to do. Probably froze a little bit at some points because I wasn't quite sure what it is. The count of 3. 1, 2, 3.
Okay, and then just a few steps backwards. No, it's not so natural, but that's it. Almost there. Keep going. And you're there. Head down. Carly was a bit shocked. I think it probably would have been a little bit scary just seeing someone in that, not so quite conscious state and sort of seeing someone a little bit sicker.
Paramedics could do little more than deliver Jodie to emergency in a stable condition.
It'll be a long road for me before I'm completely confident. I can't say I walk into a job now and be cool, I can run this job or whatever. It's still going to take me a while, but I'm getting better each day, I think.
Jodie would spend 2 days in hospital under close observation. Doctors suspect she was suffering a severe reaction to the tick bite. She cut short her working holiday and returned to be with family in the UK. Trainee paramedic Rebecca worked previously as a manager in a car parts factory. Her career change was driven by a very personal experience.
In August 2009, my dad was diagnosed with a brain tumour. The week that he passed away, he was at his most vulnerable, he was at his most sickest, and there was one nurse that made such a difference, just the compassion, the care that she had, made such a difference to my dad, and that's what made me decide to become a paramedic.
What's the problem? Tell me exactly what happened.
I'm ringing on behalf of my brother. He found cancer in his spine.
Okay.
And he has cancer in other organs. He's on his own here. He can't lift. He hasn't had any medication.
Night shift on Sydney's North Shore. Rebecca is facing a job very close to her heart.
Just reassure him that help is on the way. Just reassure him that help is on the way.
After 2 months on road, trainee paramedic Rebecca attends a job that revives very personal memories.
In 2009, my dad was diagnosed with a brain tumour and he passed away. There was one nurse that made such a difference to my dad, and that's what made me become a paramedic.
On Sydney's North Shore, a 67-year-old father of 4 has severe back pain.
Because of his cancer, they've possibly already got him on morphine.
We were called out to a gentleman with back pain. He was just released out of hospital yesterday, and the notes that came down on the computer had told us that he's got cancer of the spine.
What's your name?
It's Beck. What's your name?
Phil Beck.
Phil.
Phil is well known in the community. The retired accountant has spent the last year and a half as lollipop man at the local primary school.
Right hand.
Oh, sorry. When we arrived there, we had his daughter, we also had his sister. It was such a warm welcome. I think more relief from the daughter because she was really worried about her dad. Whereabouts are you having the pain, Phil?
Just there.
In the back part, this area here, yep. Is that where it saw the most?
It's my father. He had bladder cancer, which was operated on a few months ago, and it's now spread to his rib, his kidney, his liver, and it spread up his spine. So he was in hospital for 3 weeks when they gave a spinal operation, and they put screws up the side of the spine and scaffolding to try to support the spine. So that was done a week and a half ago.
Just been totally unable to stand up.
Yep.
Phil has been prescribed heavy medication to keep his pain in check, but today he wasn't able to get up to take it.
He's in a lot of pain. He can't really look after himself.
All Rebecca and Chris can do is relieve Phil's pain as best they can.
You allergic to anything that you know of?
Only empty malt whiskey bottles.
God love you.
I guess the good thing is he has his humour still.
Oh, you love pain too?
Frustrating as it is.
Okay, mate, here's some morphine for you, matey. And hopefully that'll take that pain from a 4 out of 10 to a 1 out of 10. Phil?
Beautiful.
That should work within a couple of minutes.
I don't want him to go away. That would be really bad.
Yeah, that's what I thought I'd do. I wasn't going to drive it.
He may be terminally ill, but the father of 4 hasn't lost his sense of humour.
Do you think you could tolerate a few sips of water? Yeah?
You jest.
Oh, beautiful.
Could I tolerate a few sips?
Oh, God love you, mate. Well, I saw a few bogues in the fridge there, mate, and I thought you might sort of like...
Cascade, you mind? No, I'll leave the holy water till I come back.
Considering what our patient is going through at the moment, he does have quite a lot of cancer throughout his body and he has had a lot of operations to try and get rid of the cancer. His spirits are just so high. He's just a laugh a minute. That's it. Now, Phil, what I'm going to do is I'm going to grab your feet and help you swing around, okay? Here we go.
No, I was
A lot of pain. It's all right.
Rebecca had a really good rapport with him and had that caring nature about her as well.
Phil, how's the pain at the moment? He said to me that, 4 hours ago he had no idea what was going to be happening, and, now that we've got him out of the pain that he was in, he was just so grateful.
You are in my... I'm not cracking. You're in my highest admiration.
Thank you so much.
Thanks, Chris.
Stay where you are, mate. Stay where you are. We'll get you out, okay?
Yeah.
Cancer, by far, is probably the ugliest thing I've seen in this job. Some people recover, but some people don't. And for almost everyone, it's a really horrible journey.
I feel all A-OK now.
Yeah, we made you better, mate. That's the main thing.
It's such a great feeling to have patients that are grateful for the work that you are doing for them. There's some days that are hard, but it helps every day knowing that my dad played a part in me finally finding the job that I love doing the most.
The 67-year-old passed away, surrounded by family and friends in respite care 2 weeks later. Next time on Recruits.
How you going?
It's out of the classroom and onto the streets for Danny and Raina.
Look after my mum, you idiot. Look after my mum.
And will Blake pass his last practical and make it out on the road?
This is something that I've always wanted to do, so it's pretty important that I prevail.
And for more Recruits action, log on to the website.
Geez, you nearly took out that car. See how close you got to that car?